As usual, we're going to give you an update of the international and national situation regarding COVID-19, and we're going to address some of the questions asked to us. The world, with 182 countries reporting COVID-19 cases, has a total of 2,520,522 confirmed cases, and 88,632 were reported on a day. 176,786 deceased people, with 6,927 fatalities in a single day, with a lethality of 7.01%. The region of the Americas also reports a growth in numbers, reporting 75,288 confirmed cases, 44,927 more than yesterday, and this represents 38.85% of the total number of cases in the world. It also has a cumulative total of 52,686 fatalities, with 3,081 in a single day, for a lethality of 5.38%. A total of 12,137 visitors remain in Cuba. Of them, 7,050 are Cubans who reside abroad, and 5,087 foreigners. In rental houses, the data remains the same, with 954 foreigners concentrated in Santiago de Cuba and the municipalities of Plaza, Playa, Centro Havana in Havana. A total of 3,369 patients have been admitted in our hospitals. 32 patients under surveillance, 2,502 are suspected cases, and 825 are confirmed cases. At the primary healthcare level, we have 5,681 under surveillance. These are cases with some risks or convalescent patients who have to stay for 2 weeks under observation. For the detection of SARS-CoV-2 virus, 1,967 people were studied yesterday in Cuba, almost 2,000. Of these 1,067 samples that were studied, 46 tested positive, for a positive rate of 2.3%. After this result, our country accumulates now a total of 34,243 samples studied, of which 3.6%, that is 1,235, have tested positive. Let's recall that one of the main goals of our program, which mirrors those from countries who have had a relative success in the facing of the epidemic, is to study a large number of people, targeting specifically those risk groups and going beyond to find asymptomatic carriers. Of the 46 new cases confirmed, all were Cuban. 40 were contacts of confirmed cases, and in 6, the source of infection could not be established. Of the 46 new cases, 25 were male and 21 were female. 45.6% were women. 65.2% of this, and this is a remarkable data, of the positive cases were asymptomatic. If it had not been for the study that was made on the person that was apparently healthy, these 30 cases would have never been identified, and they would have been spreading the disease in the community. Of the 46 diagnosed cases with COVID-19, the age group with the most cases is the one from younger than 40 years, with 24 cases, 52.1%, followed by the age group from 40 to 60 years of age, with 12 cases, the 26%. The provinces with the most cases were Havana with 17 cases and Pinar del Rio with 15 cases diagnosed yesterday. Of the 1,235 patients diagnosed with COVID-19, 811 show a stable clinical evolution. We grieve the loss of 43 people. We have to report the death of 3 people yesterday. We have 2 evacuees and 365 cumulative releases from hospitals. 24 people were discharged on Wednesday. This means that 29.5% of the patients who have been confirmed in our country with the virus have already recovered. Of those discharges, the highest numbers are from Havana with 136, Villa Clara with 83, Matanzas with 37, Pinar del Rio with 25, Camagüey with 31, and the province of Santiago de Cuba with 14 discharges. These convalescents include people who have already returned to their normal lives after being under observation at home, and others are still under surveillance at their homes. We are reporting 10 patients in critical condition and 4 in serious condition. As I said earlier, we grieved the loss of 3 people to COVID-19 yesterday. A 74-year-old male Cuban patient from the municipality of Cotorro here in Havana. As pre-existing pathology, he had chronic lung obstruction, bronchial asthma. He was admitted to the Salvador Allende Hospital, and he had already spent 8 days in intensive care unit. And despite all the efforts and the treatment he received, his clinical condition worsened, and he passed away yesterday. An 86-year-old female Cuban patient from Cerro municipality, also from Havana, with history of bronchial asthma and senile dementia. She had been admitted to the Salvador Allende Hospital. She spent 7 days in the intensive care ward, and her condition worsened, and she died yesterday. And an 87-year-old male patient from Guantanamo with a history of high blood pressure, ischemic heart disease, idiopathic ulcerative colitis, and he was being followed up by the urology service since he was suspected to have prostate cancer, and he started with the respiratory symptoms. He was admitted to the hospital. He spent several days hospitalized. His condition worsened, and he died. As you can see, one of the elements that contributes to the worsening of the clinical condition of the COVID-19 patients that lead to their death has to do with age. Although we have also had people, younger people, but primarily the age factor prevails, as well as the associated pathologies. There is no need to tell our people about the care. Everybody, we must follow with the elderly who suffer from these chronic diseases, that many of us suffer these diseases, and we have to follow up our treatments, and the elderly is part of a risk group, and that is why they should not go out of their homes, and they should remain in the protective environment of their houses. And this is a question from Grandma Daly. What measures have been taken to protect people in prisons, and what cases have been suspected or confirmed in those facilities? We have seen information about outbreaks that have occurred in prisons in some parts of the world. Prisons are difficult settings to control once these outbreaks occur, and they can cause a high mortality rate. We in Cuba can categorically affirm that we have not had either outbreaks or confirmed cases in any of the prisons in our country. And to provide this information, we spoke with the Directorate of Medical Services at the Ministry of Interior, which explained to us the different measures that the ministry has been taken, and the rest of the agencies of the central state administration, as well as the Ministry of the Armed Forces, since they are part of the temporary group that has been working on the plan for the prevention and control of this disease since its inception in January. It is an important number of measures that are aimed at minimizing the risk of introduction and transmission of this disease within prisons. They include hand disinfection at all access points to the units, using alcoholic or chlorine solutions. The presence of workers or visitors with fever, respiratory symptoms, or without masks is not allowed. Epidemiological surveillance is guaranteed for 15 days for inmates who enter the unit from the community, and they are kept at an isolated level in order to detect any symptoms in time before they can infect other people. The number of people participating in visits is limited. Measures were enforced in the admission, observation, evaluation, and diagnostic rooms, as well as in the waiting areas for visiting rooms, and the number of people participating in family visits has been limited. In the visits, measures were reinforced in the admission areas in order to detect any suspicious cases, and twice a day an active screening is carried out to detect cases of fever and respiratory symptoms and take immediate isolation. In the event of having to hospitalize a suspected or confirmed case, they are sent to the care centers designated by the Ministry of Public Health, and isolation areas have been set up in prisons for inmates with respiratory symptoms, and the conditions are also in place for the evacuation to a hospital or unit by specialized medical transportation.